video number 2 for all of the things that I forgot to do or did not do from my last video. Thank you, Dr. McMillan. So I have my patient here. I've washed my hands, I've introduced myself. She's here for a well visit. Things that I did not do was, first, I did not assess the eyes. So I just want to, I'm looking at the eyes, looking at the sclera, the conjunctiva. There's no purulent drainage. There's no redness. There's no pain when I touch her eyes. I did not assess optic nerve number 2 using the Snellen chart. So with the Snellen chart, the patient would stand 20 feet away from the chart. If they wore glasses, they would wear the glasses. I asked the patient to cover one eye and then the other eye. First, we'll ask them to read the lowest line that they can read, and that will determine their visual acuity. So if they stood 20 feet away, so if it said 20/20 on the chart that they were able to read, that meant that their visual acuity is 20 feet. They're able to read 20 feet, what a normal person is able to read at 20 feet. Okay. All right. So now with my patient, I'm going to assess her sinuses, palpating for tenderness. Okay. I'm going to check for trigeminal nerve number 5, using sharp and dull on her face just to distinguish if she can differentiate between the two. Okay. I also have a cotton swab here to determine to assess the corneal blink and to see if she's going to blink. I won't really do that. Okay. And while I'm here, I also am going to assess cranial nerve number 9, the spinal accessory. So like for her to press up. Okay. Oh, and I forgot with the trigeminal is that I want you to push your face against my hand, assessing for strength and determine if there's any weakness. Okay. Oh, and the eyes. We're checking the pupils. So I do not have a pen light. But I do have, this is going to be my pen light. So when I assess the light, I turn down the lights and I'm looking at, to make sure that her pupils are dilating briskly. I'm noting the size of each pupil, okay? And for accommodation, I ask the patient to see if she can put both hands up or look far away, and just to make sure that the pupils are dilating on their own. So can you put your hands together, if you don't mind? And I'm going to make sure that each pupil is dilating on its at the same time. And then I'm going to shine the light to make sure that each pupil is also dilating on at the same time. For convergence, I'm going to ask her to focus on the pen light, and I'm going to bring it to the bridge of her nose, seeing that the eyes are converging at the same time. Okay, now I'm going to assess now her trach. I'm looking to make sure that, her nose, I'm sorry. Let's go to the nose. Okay, so with the nose, I'm just making sure that the nose is midline, that the nose is, the mucuses are soft, making sure that the nose is patent. I'm not going to occlude each nostril. Take a deep breath, breathe out. Deep breath in, breathe out. And her nose is also palatable, and there's a septum. Okay? Okay. I'm looking at her trachea looking to see if there's any nodules, any masses, making sure that it's midline, soft and tender, any tenderness there, okay? I'm going to assess her thyroid, ask her to come up and turn, thank you. And I'm going to come down here, come down the isthmus, I believe it's the isthmus. And there's just making sure that there's no goiter that's palatable, there are no masses, there's nothing tender. I'm going to ask you to swallow. Okay, all right, very good. All right. Oh, and I'm going to assess for ICFONI, okay? And I'm going to ask the patient to say E. If I hear an A, it's abnormal. Please say E.
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 Okay. E.
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 Okay. Okay. You can lay back now. Now I'm going to, I missed the percussion of the 4 quadrants of the abdomen. Okay. Assessing for tympany and for dullness in the 4 quadrants. Okay. Okay. Now I'm going to check for I'm going to do light palpation of the abdomen, checking for masses, checking for tenderness, looking for any abdominal scar, asking the patient when was the last time she voided, any issues, looking for ostomies, okay, maybe Foley's or abdominal scars. Now I'm going to do deep palpation with 2 hands. Okay. I'm assessing for lower right quadrant pain. Any pain? Okay. I'm now going to assess the gallbladder for cholestasis. Okay. I'd like for you to take a deep breath. Now hold. Now breathe out. Any pain here? Okay. I'm now going to bimanually assess the kidneys, proper technique, underneath the abdomen, and take a deep breath. Oh, take a deep breath. Now breathe out. Okay. Do not feel the kidneys. Okay. I'd like to now assess for the vertical span of the liver. Okay, first palpating upward from the midclavicular line, from dullness, tympany to dullness. Dullness, I hear it. And then I'm going to come down and I make a mark here. And then I'm going to assess from resonance to dullness. So the vertical span can be no more than 6 to 12 centimeters. I believe that this is the vertical span of her liver. Okay. I'm also going to assess for the psoas, which assesses the appendix for appendicitis. So I'm going to ask you to lift your leg up against my hand. Do you feel any pain?
Nope.
Okay, all right. And I believe that I have concluded my health assessment video. Thank you very much.